Hi, and welcome to the NSGU podcast, Union Matters. My name is Mary, and I'm going to be your host for today. I am a member of the NSGU's Political Action Committee, and I am also the president of Local 43, which represents the lab workers of Canadian Blood Services. I'm coming to you today from Ottawa, where I've just participated in a lobby that was put on by Bloodwatch and the Canadian Federation of Nurses Unions in support of a Senate bill, Bill 252, that was introduced by Pamela Wallin, which is the Voluntary Blood Donations Act. And today I have with me Pauline, who is the chair of the Canadian Health Coalition, as well as the secretary-treasurer of CFNU. So welcome, Pauline.
Yeah, thank you, Mary. It's a pleasure to be here with you today and to be interviewed and to talk a little bit about the Canadian Health Coalition and what we do nationwide.
Yeah. So it's. Can you tell us what the Canadian Health Coalition is?
Sure. It's a coalition of partners that span a variety of groups, including unions. We have churches, we have a lawyer, we have a doctor. They all sit on the board, and students and concerned citizens that participate on our website, etc. So we are committed to enhancing, expanding, while also preserving and protecting the Canadian health system to ensure that it remains public, not for profit, based on need, not greed.
Okay, that's awesome. That's obviously something I think that all our members care about. So you work with the coalition, the health coalitions in the different provinces and territories as well?
Yes, we do. We are closely affiliated with the Nova Scotia Health Coalition and have been for a number of years now. So we work right across the country with health coalitions, and they are the on-the-ground people. They are the ones that do the campaigning or the letter writing, etc. Whereas the National Health Coalition, the Canadian Health Coalition, we are more of a research and policy in order to give the health coalitions in the provinces on the ground the ability to do their campaigning by providing them with information and statistics or whatever they need. We have a monthly call that all the health coalitions participate in. And it's, as I said, it's a conference call, so we can keep our finger on the pulse of what's happening in all the different provinces and territories when they're able to participate on the call, so that we are, in the know and can support the coalitions where needed.
Okay, that's great. And I was actually taking a look at your website this morning, and I'm actually part of the Nova Scotia Health Coalition, so I know what a amazing resource, you guys are. And I feel like, that's something I wanted to share with our members, just the wealth of knowledge that is there and that you guys provide, because I really feel like that's something that our members can use for, when they're campaigning for these different health issues in our own provinces. And I'm sure you're aware we have quite a few issues going on in Nova Scotia right now.
Yes, that's for sure. And even for regular everyday members, if they are, talking at work to their coworkers and they need support for their position on, that for-profit healthcare is really not the right way to go, they can just go to our website. We have fantastic myth busters there for people, anyone that can look at it and actually see why for-profit healthcare is bad for the health of Canadians.
Yeah, no, that's wonderful. And so is that one of the reasons that you're here involved with the Blood Watch? Well, obviously you're also part of the CFNU, one of the executive, but so is that one, obviously you support that as well. What are some of the other campaigns that you support?
Yeah, we were really excited to partner with bloodwatch.org on this. And in my role as Secretary Treasurer of the Canadian Federation of Nurses Unions, it's our mandate to partner with groups that need support from health workers, nurses, and others from across the country on an issue so important as keeping our blood safe and secure, and the system itself is sustainable.
Oh yeah, it's I think, well, for me it's imperative, not just because of the work that I do every day. So I work in the component production lab in Dartmouth, and also sometimes the product distribution side of it. So I follow, basically, if you donate blood in Nova Scotia, PEI, or New Brunswick, there's a good chance I've had my hands on your blood.
Oh, that's neat.
Or processed it in some way. So I've basically, what I do is from the time the donation comes into the lab, this is a simplified version, I process it, I spin it down, separate it into its different components, and then get it ready and send it out to the hospital. So I see the direct impact that, I hear about the stories from the patients, and I'm sure, you're on that other side as a nurse, and you see the direct impact it has on the patients. But also for me, it's I have family members who use the product, and I have a family member who is affected by the tainted blood scandal. So that's one of some of the reasons that it's so important to me. And yeah, no, I really appreciate the fact that you and Blood Watch, worked so hard to make this happen.
Yeah, it was for me as a registered nurse, and I'm still a practicing nurse as well. That I wear a lot of hats, as they say.
I think a lot of us who are involved, you start getting involved in union stuff, and you end up getting more and more of those hats.
Well, that's what they say. If you want something done, give it to a busy person.
Yeah, you're going to get stuff done. Mm-hmm. And I can tell already that you are somebody who, you're a force to be reckoned with.
Oh, well, thank you.
I noticed that on the Hill yesterday.
Well, in my role as a registered nurse, I work in the recovery room at the University Hospital in Edmonton. Mm-hmm. And I do give blood and blood products. And it was very coincidental, I think, that just last week when I was at work, we had a patient that required a plasma-based product in the recovery room. And so as I was, doing your double check before you administer it, I was thinking in my head, wow, how fortuitous is this, that next week I will be on the Hill lobbying to protect the Canadian blood system as we know it.
Yeah. So for those of you who may not realize, what this bill is it's essentially banning paid plasma. There's a company called Canadian Plasma Resources who have opened up a plasma collection center in Saskatchewan, and then also in New Brunswick in Moncton, where they are paying people to basically, they're paying people for their plasma, which is the yellow straw-colored portion of their blood. And this product is being sold on the international market, where it will never be used for Canadian patients. It's being sold untested, and it leaves the country, and it's drawing donors away from the public system. It's now been shown in Saskatchewan, and we're starting to see it in New Brunswick as well, where our donor base is dropping. So it's pretty scary stuff. It absolutely threatens the supply on Canadians' blood supply, as well as, I think, putting us at risk of moving towards an Americanized system, which I think is what opened the door to the tainted blood scandal in the first place, where, thousands of people died and were infected with both hepatitis C and HIV. Nova Scotia, it pretty much wiped out our hemophiliacs which is just such a tragedy. So that's why, this is a really urgent issue. And it's also a really urgent issue in Nova Scotia because we do not currently have any sort of legislation in place to ban this practice. And so some provinces, Alberta, Ontario, Quebec, and most recently BC, have banned this. So this predatory company cannot, and others who are lined up to try to get licensing from Health Canada, they can't actually operate in those provinces. But in Nova Scotia, we've yet to have a commitment from our health minister to introduce this legislation. And we know that Canadian Plasma Resources has plans in place to open up a clinic. Well, I can't even call it a clinic because if you think of clinics are some, they help people. They're part of the health system. This is a predatory center where they will be taking these blood donations and sending them offshore. So, yeah, so it's really scary in Nova Scotia right now.
Mm-hmm. It is. It's scary. And the other thing that's interesting is that the price of plasma per ounce is actually more than an ounce of gold.
Yeah, and that's why they call it, it's big, $1 billion industry, and they see Canada as this untapped market to come in. And it's really scary when you start to put money over people's health. Healthcare should not be about money because that's when you open up the door to health tragedies.
Yes.
And I think then there's a lot of information about this on the Canadian Health Coalition website.
Yes, there is, and bloodwatch.org.
Yes.
They're the organization focused entirely on this subject.
Yeah, and Kat, who's the executive director, who we were hoping to speak to, but she's unfortunately lost her voice this morning because she's just been yelling up a storm on the Hill and working so hard. She does invaluable things, and I think it's really important that our members actually go to the website and support in as much as possible.
Agreed. I couldn't agree with you more.
Oh.
Some of the other things the Health Coalition is working on and has been for a number of years now is, pro-public Medicare, as in no privatization, in particular privatization for profit, because people should not be making profit off the backs of sick patients. Absolutely not. And then, of course, pharmacare, the National Public Drug Plan. And I know Nupji, who sits on our board, big supporters of those things that we have prioritized over the years. And, of course, it ebbs and flows with whatever's happening in each of the provinces. But we are on the cusp, I believe, of getting a national public drug plan for the country of Canada. All the provinces and the territories are, poised right now. We have been successful with this Liberal federal government for them to set up a committee on the implementation of a national pharmacare plan. So it wasn't to have another study about...
Yeah, that's the thing that's really exciting is this is an actual committee, and they've actually been doing, consultations across the country. So I know the Nova Scotia Health Coalition, and I know that NSGU as well have put in submissions, basically what we want to see pharmacare looking like, because there's different people have different ideas about what it should be, don't they?
Yes, they totally do. The fill in the gaps model that's out there floating around, but really what we need is what we've been calling the full meal deal.
Yeah, because it really will save Canadians billions of dollars in healthcare, won't it? If we can actually manage to make it a truly national public system where it's free drugs for all. Yeah,
it will. It'll up to $13 billion, billion with a B.
And I think it'll save, thousands of people's lives.
Absolutely. The CFNU did a cutting edge piece of research, and we called it body count. Sounds like kind of a morbid name for a research paper, but it really is about people who die because of inaccessibility to their medications for a variety of reasons. And, Steve Morgan said it's like a full plane load of people going down every couple of months in the country. Like, we wouldn't stand for that. And yet we turn a blind eye to the medications, the costs, the inability for people to maintain purchasing them. We think as union members, we have pretty good plans, and yet we still have to pay something.
Yeah, no, absolutely. I mean, we do have a good plan. I'm really lucky in that I have an amazing plan. So I get chronic migraines, and, for 6 pills, it's something like $80. And my best friend who runs her own business, she's working really hard, and she does not have a health plan. And she also gets chronic migraines. And for her, these are essential drugs, but the amount of money she's spending on the same migraine medication, she just, sometimes she just suffers through it. And I know our members who work in healthcare, our nurses, the stuff that they're seeing in the hospitals. And I've had discussions, and I'm sure you're seeing the same type of thing, people coming back in because they can't afford their medication.
Yeah. And it's, part of the unfinished business of Medicare. Tommy Douglas, he had a vision, and the vision was that all health be covered under Medicare, and that would include vision care.
And teeth.
Which is a dental care.
For anybody who's ever had an abscess tooth, I'm sorry, well, that can kill you. Yeah. And that is a healthcare issue. And to try to, I actually have a broken tooth right now. As you can see, it's half a tooth. And I've had that for quite a while because I've been waiting on approval from my benefit plan to actually get back to me to let my dentist know that they'll cover half of my crown than I need. So I've been walking around with half a tooth. We're hoping that it doesn't get, reinfected or anything like that. But the system we have now, that's not considered a health issue. I don't understand how, because it's in your mouth, it's not part of your body. It doesn't make a lot of sense, does it?
And we're the lucky ones because we have good plans.
Oh, absolutely. There have been times when I've said, I cannot afford to lose my job because I unfortunately have been blessed with bad teeth. My grandmother says I have her teeth. Where I will, my dentist has said she's never seen anything like it. I go from having a spot to a full-blown filling, and it has been my saving grace that I've got an amazing dental plan. And I know people who live in horrible pain. There are people who live in horrible pain. They pull out their own teeth. They're embarrassed because they've got crappy teeth, to be blunt, and it makes it hard to find a job. So because, you have to be professional, and and I've talked to some of our members who are, dental hygienists and who do cleaning and work with public health, and they're going into schools, and you've got these children who are, and Nova Scotia has a real poverty problem. And even though there is coverage for children, thank God, up to a certain age, but there are kids who are living in pain with bad teeth, and I know our members see it. And, it's really, I think, a part of the healthcare system that's just letting people fall through the cracks and living in pain and suffering. And it's just, we really do need Tommy Douglas's, we need a true national healthcare system. And we don't really have a true national healthcare system, do we?
No, we don't. We have a bunch of silos and a bunch of provinces, and it's really determined by borders as to what is covered and what isn't covered. And even if you're in the hospital, those drugs are covered, and if you go home, they're not covered. So it's just a mishmash. And what we really need is a full meal deal where the entire body is covered, including drugs, to keep people healthy so they don't end up in the healthcare system. Well, and the healthcare system really is misnamed. It's really a sick care system because you only go to the hospital when you're sick. So if we can keep more people out of the hospitals and at home in their own homes for longer, living a happy, healthy life, that would make Canada even a better place than it already is.
Yeah. And I think obviously Canadians agree because they're so proud of what we do have. And I mean, wasn't there a contest about, basically Canadian, the greatest Canadian, and Tommy Douglas won for, his vision of healthcare. And he was actually involved in the, was he involved in the creation of the Canadian Health Coalition? I was looking and saw a picture of him there or he was at least involved in some way.
Yeah, I think he kind of spurred it into birth, if you know what I mean.
I think he inspired a lot of Canadians to fight for this. So,
Agreed.
So how can, if our members want to get involved in the Canadian Health Coalition in any way, is there anything that they can do to help you do your work?
Yes, of course, there always is. The Canadian Health Coalition is funded by great people like you, and your members who donate on a regular basis so that we can do the good work. And we are a 2-person office here in Ottawa. We punch way above our weight. People cannot believe we only have two staff people. We have an excellent board, I have to say.
Yes, I met some of your members yesterday and was actually lobbying on the Hill, and, absolutely forces to be reckoned with. And I was really proud to stand beside them and talk to, senators and MPs and just the knowledge base that's there.
I'm so glad to hear that. Very pleased to hear that. We are, a participatory board because we only have 2 staff. So we work very closely as a board, and always, keep an eye on our website, as on occasion we would like people to sign up on a petition or participate on a letter writing campaign at the Health Coalition. I know that Nova Scotia has a very robust health coalition there, and that's fantastic. And we work very well with them on whatever their topics are. It's funny that you think, maybe your topic is unique in your province or in your territory, and it's not really. I'm sad to say that those bad things go from province to province, and it really just depends on who the government of the day is and what their mantra is as to what the challenges are occurring within the healthcare system in the provinces. But always keep an eye on the healthcoalition.ca website to see what's coming. We will be having a lobby at the end of January, the Canadian Health Coalition. We have one once a year. And so we'll be sending out information for those who are interested. And it's to come and lobby your MP. And the topic this year will be pharmacare.
Okay, that's awesome. And for those who can't actually make it to the lobby on the Hill, they can actually go out and see about meeting with their own MPs in their communities, can't they?
Absolutely, yes. We will have information available on the website. You can print it off, take your own notes, whatever, and go see your MP in your own constituency. And that's pretty powerful because, a lot of lobbies come to Ottawa, but to have a similar lobby with the same topic and the same speaking points in the constituencies, that holds a lot of weight, because the MP then says, oh, wow, people are really taking this seriously and want some change done.
And they're getting ready for an election as well right now. So I think that's where we really can have political power, because I think when you have a constituent show up to your door when you are in the middle of, getting ready for that re-election, and they are armed with knowledge and they're ready to sit down and talk and fight for this, I think that carries a lot of weight.
It
that
sure
somebody's
does.
actually taking the time to show up in the community. So, we always think, well, I can't make it to the, that lobby on the hill. What can I do? But that's where in your community, it really is important. And,
yeah, that's what they say, right? Ain't no power like the power of the people. And the power of the people won't stop.
Yep, exactly. And I think it's provincially as well, we need to start showing up. And I think for healthcare in Nova Scotia, we really need to get out and vote out our current government. You've recently done that in Alberta, haven't you? And are you finding a difference in the provincial government you have now?
Yes, it's a huge difference. We have Rachel Notley as our premier, and she's a New Democrat, and their policies have been amazing for the last few years. We will be having an election next year, and I'm sure that Albertans will make the right choice and keep Rachel Notley in office. Her policies have been amazing. It's been since she was in power that the health minister banned the for-profit plasma clinics, and they have been building and hiring instead of firing people and laying people off and decimating systems that really need to be kept and built up. So we're really happy right now in Alberta. After 44 years of having a conservative government, to have a breath of fresh air in the NDP is, I'm just so happy. And just by way of tidbit of trivia, Rachel Notley is a Labour lawyer who used to work for the United Nurses of Alberta. So she knows union issues, she knows healthcare issues, and I like to think that she's one of our own that has now moved on to be the Premier of Alberta.
Yeah, and I think so. NSGU we're nonpartisan, but we have, gotten the mandate because the McNeil government we got the mandate from our members because the McNeil government has basically tried to destroy us as a union and unions in general to try to get rid of him. So I think what's really important is to actually look at who you are, who is running and what their background is, and also, are they, and talk to them and say, are you going to support me? Getting a fair collective agreement. Healthcare teachers in Nova Scotia, we've been at this standstill, and we're just now finally through a huge amount of work and all the unions coming together and working really well together. And, they were hoping that the unions would rip each other apart, but we've actually worked really well. And I think one thing that the McNeil government has done for unions in Nova Scotia is he's worked really well in bringing us together and really to fight him. So I think it's important that, going into any election, that we really need to, think critically about, you may like the person running for that party as a person, but are they actually going to be able to follow through? And, because I think having the right government, in Alberta has shown what a huge difference it can make and how it can start to turn things around. So.
Yeah, that's right. I want to be clear, too, the United Nurses of Alberta also nonpartisan.
Yeah.
As well as the Canadian Federation of Nurses Unions. We are also nonpartisan. But I guess that's a personal glowing review of what's going on in Alberta right now.
Oh, absolutely. And I'm sure if it was any other party who was making these changes, you would, be giving them the same glowing review. I think it's not necessarily the party, it's the actions of that governing body, because
exactly.
I mean, let's face it, the parties from province to province, and actually just from leadership to leadership, can be vastly different. Liberal Party in one province can be completely different than the Liberal Party in another province. The same with Conservatives. You know, you have a red Conservative, which is more, you know, the traditional or leaning more center as a, you know, it really,
True.
It's complex. So I think that's where you have to look at it, you know, critically and keep yourself aware of what's going on. And I think we really need to make sure we get out and vote, because we
Absolutely.
have, you know, it has a huge impact on
That's where
our
the power
lives.
lies. That's where the power lies,
Absolutely.
is in the vote.
Yeah. So,
Absolutely.
And I think our healthcare system really depends on us getting out and fighting. So I really want to thank you for all the work that you do, and for coming and talking to me and our members about what you do. And
Well, thank you for having me.
It's really been a pleasure, and I look forward to hopefully doing some work with you again.
Absolutely. I look forward to the same. And I know we have a great board member in NUPG that sits on the Canadian Health Coalition board. And for sure, we always
And that's
enjoy.
Anil, is it?
It's Anil Naidu.
Who I've actually met before. Yeah, he chaired a multi-union meeting for Canadian Blood Services. So yeah, he is a really good guy, and I know that we have a really good representation with him on that board.
You're right. You're right.
Yeah.
We have good, strong people on our board.
No, it's good, and hopefully our members can help support the work that the Canadian Health Coalition does. And I really appreciate the fact that you guys do the work that you do, and you have that information. So you mentioned that report about healthcare earlier. Is that on your website so
That's
people
on
can look it up?
It's on the Canadian Federation of Nurses Unions website, cfnu.ca.
Perfect.
It's called Body Count, and it talks about the negative impact of not having a pharmacare plan, a national public drug plan for everybody living in Canada.
Excellent, because I've actually looked at that report, and it is a really great report, and it's a really great resource to have for, you know, when we're making our arguments for pharmacare. So thank you very much for...
Well, thanks again, Mary.
All right. Have a good trip back to Alberta.
Thank you very much.
All right. Bye.
Bye.